Hello, my name is Miles, and I'm going to be doing a presentation on hepatic cancer, also known as liver cancer. Where is the liver located? So the liver is located on the upper right side of the body, below the diaphragm and the ribs. It is the largest glandular organ. The liver has 4 lobes, 2 in the front, the right and the left, and 2 smaller ones on the back. Generally, it breaks down alcohol, drugs, and toxic wastes from the body. So the liver stores the nutrients, it removes the waste products, filters and processes chemicals, produces bile, has a clotting factor, insulin-like growth factor, production of urea, cholesterol production, and release of the glucose. What is liver cancer? It is a cancer that grows in the liver, and then sooner or later it grows out of control. So there's the primary liver cancer, which are the hepatocellular carcinoma. It's the most common. Then there is the bile duct cancer, which is a cancer within the bile ducts. And then angiosarcoma and hemangiosarcoma, which is pretty rare. And it starts in the cells lining the blood vessels of the liver. Then there is also hepatoblastoma, which is rare and found in children. The secondary liver cancer, which is the metastatic liver cancers, they do not start within the liver. They spread to the liver. So it can come from, say, the lungs. Okay. And then there are also benign liver tumors. These can grow to size, but they do not grow near tissue or spread to distant areas. Okay. What causes liver cancer? So there's DNA changes, certain chemicals, hepatitis B and C, and liver damage. The people most likely to develop liver cancer would typically be males. Asian Americans, Pacific Islanders have the highest rates. Long-term infection of HBV or HCV, cirrhosis, which is the damage to liver cells that is replaced by scar tissue, most common in alcohol abusers. Non-alcoholic fatty liver disease, which is common in obese people. Primary biliary cirrhosis, the bile ducts are damaged or destroyed, leading to cirrhosis. Inherited metabolic diseases, such as hereditary hemochromatosis, absorbs too much iron, and then all of that iron leads to cirrhosis and liver cancer. Heavy alcohol use, tobacco use, diabetes type 2, which factors with obesity, heavy alcohol use, and chronic viral hepatitis. Rare diseases like tyrosinemia, and so on. Then there's the toxin, the chemical alpha toxins, which is a fungi that contaminates peanuts, wheat, soybeans, groundnuts, corn, and rice. So you can get it by long-term exposure. Then there is the thorotrast, again, exposure to more chemicals. And also it can be found in anabolic steroids, which is mostly used by it's used by athletes, and it is a male hormone. Don't get it confused with cortisone steroids. They do not have the same risks. Liver cancer is more prominent in countries in sub-Saharan Africa and Southeast Asia. More than 800,000 people are diagnosed in a year, and more than 700,000 deaths occur each year. This is a mortality rate from American Cancer Society. It is a chart from 2010 to 2016. So localized numbers would be 34%, regional 12%, distant 3%, and the all surveillance epidemiology and end results is 20%. According to the American Cancer Society, the estimated cases for primary liver cancer and intrahepatic bile duct cancer in the US for 2022 is 41,260 new cases will be diagnosed and 30,520 people will die from these cancers. To lower your risk of liver cancer, get vaccinated and get treatment for viral hepatitis. Signs and symptoms include weight loss, anorexia, nausea or vomiting, enlarged liver, enlarged spleen, abdominal pain, fluid buildup in the abdomen, itching, jaundice, fever, and change in liver function tests. These can also cause hypercalcemia, which is an increase in your calcium, hypoglycemia, decrease in glucose, gynecomastia, which is enlargement of the breast, decreased size of the testicles, and then erythrocytosis, elevated cholesterol levels. Diagnosis. So you can get blood tests such as the liver function test, radiographs like ultrasound, CT scans, MRI, and then a biopsy. So to determine the stage of the liver cancer, they can also use the CT, MRI, or a bone scan. Cancer research that have been done are using AI software, being pre-trained using histopathological images to distinguish cancerous tissues from healthy liver tissues. AI can be used for radiological, clinical, and histological data that will achieve a better diagnostic accuracy, tumor staging, plan of care, and evaluation of the microvascular invasion. Treatment. It all depends on the stage of the liver, then it can be operable. So there's ablation, immobilization, embolization, targeted therapy, immunotherapy, using different kinds of drug therapies like Tecentriq, Avastin, Stivarga, and Cyramza. And then there's chemotherapy, radiation therapy, and partial hepatectomy and transplant. Thank you.